we will be presenting on workplace violence. Specifically, we geared our presentation towards workplace violence in the emergency room from patients, visitors, anyone that the nurse would encounter. But this information and these tactics can apply to any workplace, anywhere that you will be interacting with people. There are 4 types of workplace violence, and they are customer-client, which in healthcare is typically the healthcare worker and the patient, and can often come from family members or visitors. Criminal intent, which would be someone who is setting out to hurt you. Maybe you're walking to the car late at night, you're in a parking garage, and someone mugs you or someone attacks you, and that would be criminal intent. Their intention is to harm you, to rob you, to do something criminal. Then personal relationship, which would be a conflict with someone in your personal life. So either a spouse, an ex, a friendship that's gone wrong, something that involves your life outside of work. And then worker on worker, which would include things like bullying, sexual harassment, things that we would do to each other. Then there are also 4 categories of workplace violence, and they can occur within any type. So these are categories that would fall under any of the 4 types that we went over. One category is sexual abuse. That is a type of violence. And then verbal abuse, which can include being threatened, cussed at, anything negative verbal abuse. Physical threats is its own category when someone is threatening to harm you. And then that can actually escalate to an assault where you are physically injured. 100% of nurses that were surveyed in a 2023 survey reported being verbally abused. 100%. So they were cussed at, they were berated, they were spoken to in a negative fashion. They were verbally abused. They were called names, they were told they can't do their job, and I think any of us that have worked in healthcare for any amount of time would probably agree. I know that I would fall into that category. 100% have definitely experienced that. I worked in the emergency room for a long time, a while back, and at one point our management, they wanted to do something to help, but they needed documentation of this. They're like, we hear you guys that you are being spoken to in this really negative way, and they wanted us to fill out a report. And for us, it was a MIDAS report. But they wanted us to fill out a report every single time that we were verbally abused, that we were cussed out, specifically is what they said. And we laughed because we were cursed at pretty much every single day, all day. If that's what you wanted me to do, I was going to spend my time sitting at the computer typing up these reports. So it is, unfortunately, something that we all experience. We are spoken to in a way that we should not be. In addition, 82% of nurses surveyed said that they had experienced physical aggression. So they weren't physically assaulted, but they were in a situation where they felt like they were going to be harmed. Someone had made them feel unsafe. And 82% is very high. That is, we should not feel unsafe when we go to work. You should definitely not feel like you are going to be physically assaulted. The majority of workplace violence experienced by healthcare workers in general, but nurses, falls under customer client, which, as I stated, is going to be our patients being frustrated, their family members being frustrated for them, and it's going to come in the form of verbal abuse, where they're just going to lash out and they're going to use their words to let us know how they feel. One repercussion of this is that what they're doing is they're taking all these very negative emotions and they're putting them on us. And one of the phrases used for that is negative transference. So they're not really mad at us. They're mad at the situation, or they're in pain, or they're upset. But they constantly put it on the healthcare worker. And over time, kind of absorbing all of that anger, frustration, pain, and all these other negative emotions, can lead to more burnout and can just make us feel that you don't want to go to work or you don't want to go to that job, and you start questioning why you want to help people when they don't seem to want you to help them. And so workplace violence, and we'll discuss throughout our presentation kind of ways that you can be aware of this, things that need to be done in reporting so that we can get better numbers, because, filling out a report every time you're cussed at, that's not the answer. So what is the answer? We'll also talk about kind of legal situations, like what do you do if you are physically assaulted? What are your options? Is it ethical to report that? How should you handle those situations? And kind of just why you should do so. Workplace violence negatively affects everyone. It affects that nurse, as I'm talking about, with just an example of being burnt out and starting to question why you're working here, and maybe you'll leave and go somewhere else, and then you're already in a bad situation, but now your hospital is short-staffed, and that affects everyone else that's still there. Being upset and being assaulted can affect patients, and we'll go into more detail on all of that as we proceed with our presentation. Thank you.
Hi, so I'm going to be talking today about priorities concerning workplace violence, specifically in the emergency department. The emergency department is one of the most shown workplaces where a nurse can experience violence, specifically patient to staff. And what I'm covering are some priorities that need to be addressed as far as workplace violence. So a huge priority for workplace violence is safety. And how do we involve safety in such a thing as workplace violence? Having an appropriate assessment tool is key to the de-escalation of violent behaviors. A lot of my sources came from the Joint Commission website, so these are standards that are fairly new. These standards were put into effect January 1st of last year, so 2022. And the Joint Commission does come out and say that there is no gold standard for preventing workplace violence, so there's no 100% way to prevent workplace violence. But what they have put together are assessment tools that can be used to prevent the escalation of violent behaviors. So in order to stop the violent behaviors before they become an issue. One specific tool for the emergency department is the STAMP tool. So the STAMP tool is an acronym, sort of like the Be Fast for strokes, but this is for escalation of violent behaviors within the emergency department, how to assess and recognize these issues. So STAMP being an acronym, S is staring, T is for tone and volume of voice, A is for anxiety, M is for mumbling, and P is for pacing. So these are things that can be easily recognized when dealing with a patient who may become violent, and how to address them and de-escalate the situation, get to the bottom of it, and hopefully fix it and prevent an issue from occurring. Again, there is no 100% way to prevent workplace violence, but this is a good tool to use in the case of an incident happening. According to the Joint Commission, diffusion tactics in the emergency setting can include clear and calm communication, non-confrontational verbiage, non-threatening body language, and early detection of assessment tools. Using these tools will prevent workplace violence a lot more than rushing into a room and becoming violent yourself. The videos at the end of the PowerPoint will show 2 different situations where a patient is visibly upset and how to not handle the situation, but also how to handle the situation and what goes along with that.
Violence displayed against nurses can have significant impact on current nursing practice, and these are just a few that I want to highlight. First, there can be both physical and mental repercussions for the abused nurse. Their body can be physically injured, or they can suffer mentally from anxiety, depression, or even PTSD from the abuse. With that being said, all nurses should know the warning signs of a patient becoming violent. Some of those warning signs may be a patient who is pacing the room, who is easily agitated, has their arms crossed, or maybe even their fists clenched. And sadly, each patient should be viewed as having the potential to become violent. We can do this by implementing universal violence precautions. You can think of these kind of like standard precautions that you see in the hospital given to every patient. You would give these to every patient to hopefully eliminate violence. Whether the patient may be violent or not, they should be viewed that way to keep the nurse safe. Violence and abuse also affects more than just the abuser and the victim. Medication errors are more likely to happen after a nurse has suffered violence from another patient or family member. And other patients' care may be delayed due to the nurse having to attend to the violent situation. And it normally involves more than just one nurse. It's several people who have to get involved, therefore delaying the care of other patients. The most important thing in regards to the impact of violence on current nursing practice is to make sure that you, the nurse, are taking care of yourself, especially if you are exposed to violence. If you've experienced violence in the workplace, make sure you're taking appropriate steps to help yourself recover. And maybe taking time off to let your body physically heal, or taking some time off for your own mental health. You could also seek counseling or therapy to help you cope with the violence. No matter what you do to get help, make sure that your workplace is offering these things to you.
Legal and ethical issues. Reporting incidents of the workplace violence is voluntary, and barriers to self-reporting include the assumptions that the violence is just part of the job, a complicated and burdensome reporting process, fear that may be blamed for the incident, and lack of support from management. Nurses experiencing workplace violence should first identify that it is an issue and not assume that it comes along with the job. Then kindly de-escalate the situation and ask for the individual to stop the act. If the individual proceeds, then the proper authorities should be notified and charges should be pressed. It is important to report workplace violence because nurses should feel safe and be able to care for patients without receiving any type of abuse or harm.
Katie, what's wrong?
I'm trying to get out of here.
Why are you trying to get out of here?
I need to go outside. I need to smoke. I'm not in a good place. I need to leave.
Do you want me to get you a nicotine patch?
No, the patch does not work for me. I've tried it. I don't want it. I want to go outside.
Can you sit down for
I
me,
really
please?
cannot.
Can you please sit down?
No, I really.
If you would sit down, it's gonna make you
Please
feel
don't lay your
better.
hands on me. Please,
it's
I need
not.
to leave.
Hey
Nope.
guys, what's going on?
No,
Just like a cigarette.
I'm trying to go outside and smoke. I'm not
This
trying
isn't
to smoke in here. I'm trying to go outside and
you
smoke.
can't go outside.
Why can I not go outside? I'm a free, independent person. Just let me go
No, we
outside.
gotta sit down.
No,
You
I'm
need to
not.
lay down.
But get your hands off of me. I'm gonna get.
You need to
I'm
lay
gonna
down so
get-
we can examine you, okay?
No, I don't want to be examined. I don't want to be seen. I want to leave. I'm trying to
No,
leave.
you're not leaving.
I'm trying to.
I'm just
leave.
gonna go call security.
Okay,
I
go
just-
on, call security.
Yeah,
You're
call
not
security
leaving.
because I'm
No, ma'am,
leaving.
you're not
No,
leaving.
I
You're
am
gonna
going.
lay down
No,
and we're gonna
no,
examine
I'm
you, okay?
Nope.
Hi.
Oh, Beth, I see that you're upset.
Yes, I am. I've been waiting 2 hours to see the physician. My blood pressure medicine is very important. I haven't taken it in 3 months, and I need to be seen now.
Yes, ma'am. So we've got you back here. We're keeping an eye on your blood pressure, and as it changes, we will make sure that the doctor is aware. Can you take some good breaths with me? Trying to stay as cool as we can will help with that blood pressure, okay? And if anything changes, we'll make sure that we get the doctor. We've got you on a monitor. If you could hang out in the bed instead of pacing, then we can monitor your blood pressure better.
Okay.
Okay, do you think we can hang out with us a little bit longer?
Yeah.
Okay. Okay. Do you need anything right now?
I'll take a cup of water.
Okay, I can get you that and I'll be back shortly. Thank you.
Hey,
Jen. So I
Hey.
talked to the patient with a high blood pressure. You know, she got a little upset earlier.
She did.
So she is a lot better now.
Good.
She said they used some really great de-escalation tactics.
Okay.
So you gave her space, used a neutral tone, had good body language. So I just want to say, great job.
Oh, thank you. Yeah, she seems to be doing better and had calmed down a little bit by the time I had left.
Good. Awesome.
Been violated. Oh.
Just want to hear if you can hear that heater, or if I need to turn that off. How loudly do I need to speak? Testing. I really want to be done with this.
I'm done. I'm calling security. I'm calling security. I'm done. I'm done.
Move. De-escalation tactics. She kept a neutral body tone. Great